Good evening. Right now at 6, another daily surge in COVID-19 cases, and the number of hospitalizations is also on the rise.
Healthcare workers are overwhelmed and say we haven't seen the worst of it.
Local 10 News reporter and investigator Amy Viteri live now with what leaders are urging us all to do. Amy.
Well, Calvin, Mayor Levine Cava today saying she plans to roll out a holiday campaign urging South Floridians to wear masks and take other precautions. That is because they expect cases to rise even more in the coming weeks due to holiday gatherings. And this comes as some hospitals say they do not have the staff to cover another big surge. And this time, no help is coming.
This is exactly why we are holding this event today, to make sure that the public understands we are up against the wall here.
Mayor Daniela Levine Cava announcing a new campaign for the holidays to get South Floridians to do their part to contain COVID-19. In a virtual news conference with hospital CEOs, many sounding the alarm, saying they don't have the staffing to take much more.
We cannot afford to get to the kinds of numbers we had in South Florida back in July because we even though we have the beds, we may not necessarily have the staff.
Friday's numbers show more than 10,000 new cases statewide, over 2,500 in Miami-Dade County, and 1,112 cases in Broward. Currently, the amount of ICU beds available in both counties is just over 19%. Hospital CEOs telling us even field hospitals like those previously set up don't help if they don't have the people to staff them.
In addition, we are being faced that they're recruiting nurses from our market to go elsewhere as travelers.
Hospitals warning the next 30 to 45 days will be a challenge if the public refuses to follow basic precautions. One bright spot Friday, hospitals now saying they've learned they will be getting enough vaccine to cover all frontline health workers.
It appears that we will now receive enough of the Pfizer vaccine this month to support inoculation of all frontline hospital workers in South Florida who meet the FDA's criteria.
And remember, back in the summer, South Florida was a hot spot for COVID-19, and hospitals had millions of dollars from the state to bring in traveling nurses. Well, that is no longer the situation, and right now much of the country is seeing a surge in cases. So whatever comes in the weeks ahead, hospitals will have to tackle it with what they have right now. We're live at Jackson Memorial Hospital. I'm Amy Viteri, Local 10 News.
A daunting challenge. Okay, thanks a lot there, Amy.